So from that, that's saying no heart disease was detected, or from what it seems. Do you think?
I mean, you've had the balloon angioplasty with Dr. Gill, haven't you?
Yeah,
so.
yeah. But whenever I asked why did I have a heart attack, no one could answer it. It was like almost like everyone was trying to avoid it.
Yeah.
So why do you think I had a heart attack?
So,
now I know I had a heart attack, but why do you think you had a heart attack?
Obviously there's lifestyle risk factors and then the genetic risk factors. So
yeah, it's lifestyle. It's basically I was drinking loads of sugar, and I've cut sugar out, and I'm feeling fine now.
Good.
But no one's asked me that. No, I mean, there's something in medicine called clinical observation. You haven't done it. All you've done is, is a heart attack, and all they've done is stick me on these drugs. So that doesn't detect any. And similarly, this is an echo scan, and that's also absolutely fine as well.
So this is an echo done recently?
Yeah, on Friday as well, all of it.
Yeah, all of it on Friday. So the left ventricle is normal intervention with good systolic function. No obvious injury was seen, which is really good. The heart function is good at 60%. So the normal you measure as a percentage of how much blood is going out with one pump. When you have a heart attack, you have damage to the muscle.
Yeah.
And the normal percentage is around sort of 50 to 55%. So 60% is very good.
60% is very good, right?
Yeah. So that's good. Your valves are all normal on here.
Yeah.
Did you see anybody afterwards to get some conclusions from all the results you had done in London?
No, just the guy, just this.
Yeah. So you saw him in person.
So can you show that the drugs are working then? That's the case.
Everything's looking good on here.
Right.
Yeah. Did he recommend any changes, the consultant that you saw?
No, but you're saying it's working perfectly then. The drugs I'm getting are perfect. Yeah.
Let's run through everything because I need to do your blood pressure and everything.
Okay,
I'm happy to do that, and then we can have a.
Okay. Came here, they ignored it, and then they, yeah.
Can I just ask you one question? Would the clinic letter from today, you write to your GP and let them know how you want to send you a copy of that? Would you like that emailed rather than posted? Is it okay to post it to your home address?
Email is good.
Email, and I think you've given your email already.
That's right, yeah. Yeah.
So you had some blood taken out. There was some blood and a blockage in the artery there. And you had the balloon angioplasty. Any medical history for you? Have you been diabetes?
No, never.
Anything like that? Nothing?
No.
And were you on medication regularly prior to this?
No, never. No.
Okay. Good. And then if we just go to risk factors, have you ever smoked?
No.
And I couldn't see, I'm not but have you ever had a test for cholesterol in the past?
No. No, I've done diabetes, no, not diabetes, no.
No, so you have a test in the past? No.
Yeah, that's right, yeah.
Do you drink alcohol?
No alcohol, no drugs, no.
And no had trouble with the high blood pressure in the past?
No.
Any family history of heart disease?
Yeah, my mum had heart disease, dad had a heart attack.
Your dad had a heart attack?
No, my mother. My dad had a stroke.
Okay.
All my mum's side of the family died of heart attacks, and my dad's side of the family died of all strokes.
Okay. And how old was mum when she died?
60, pension age.
65?
Yeah, that's right.
Yeah. And any siblings for you?
Yeah, and I don't think I will. So.
No trouble, you don't know that they've got heart trouble that you're aware of?
I wish they did have heart trouble, but anyway.
Okay. Not bad there.
No. You can write that down.
And you drive?
Yes, I do.
Can you drive?
Yeah.
Yeah. Have you engaged the cardiac rehabilitation team?
Yeah.
Is it not for you? Did you?
Definitely not for me.
No, that's fine.
Because when my heart pressure went to 160, there was a guy there, I can't remember his name, but I don't know his first name, so he's not, but he's like, what we need to do is double your dose of bisoprolol. And that's not going to happen. So I told him no, because the whole point of exercise is getting exercise tolerance. And so you run a mile and maybe you're more and so on and so forth. They're not interested in that. All they want to do is give you drugs. That's horrible. And when I confronted them about it, they were working to deny, oh no, it's not about that, it's about drugs. So what do you want? Maria Sharapova in 2016 did the same thing. She got found taking cardiac drugs to make her stamina better, you know. She might be happy with that, but I'm not. So I'm not taking yeah, so yeah, it's not going to happen.
I mean, the reason we try and ask people to stop a lot of beta blockers, it's not just...
But you do realise that my dad died of Ramapril, my mum died of Bisopril, and because of professional damage, the doctor goes, well, I don't know, it's a drug company. So I'm not going to...
But they're there to support heart function and they keep the heart rate nicely controlled. Obviously, it's a plumbing system, so you want the pump to be nice and...
But according to this, you're saying the heart...
And then you understand the plumbing process, you know. So you've been in A&E a few times. Tell me what symptoms you had in recovery.
Just, it's not really recovery. I collapsed once.
Okay.
But that was because of not eating properly.
Okay.
And no sugar, nothing in my diet, so that was not good.
So you've cut out a lot of the sweet stuff.
Yeah. I've cut it all out now, so the odd hot chocolate every now and then, I tea. But,
and do you have chest pain, or is it not been too bad?
I've had something like here, but nothing like that, no.
Have you used GPS spray?
No.
Okay. And I know they checked all your bloods and everything. They looked okay, the heart troponins, which we check. So no chest pain really. Any palpitations in recovery?
No, not really. No.
Any breathlessness?
No.
Okay. Any fluid in your ankles? They're not swelling?
No.
Good. Any dizziness?
No.
No. And you just said one of us. I don't know. You came to A&E. And you're getting fatigued when you're exercising, when you're sort of doing your normal activity? My exercise has always gone, so my exercise has always been very high, so it's always been like, when I run a short distance, my heart rate goes up. That's something that I need to get used to myself. Yeah. Okay. And medication-wise, any allergies to any medicines?
Not that I know of, no.
No, not penicillin or anything like that?
No.
And are you taking the ones that you were sent home with? So I don't know if you've got your with you, but
those
you should be taking the aspirin 75 in the morning.
Yeah.
Ticagrelor, which is brilliant because it's on the name, is 90 twice daily. You've got that for 1 year on the higher dose, and then 2 years on the lower.
I mean, these are great results.
Bisoprolol 2.5, still taking that one?
Mm-hmm.
The atorvastatin at 80 and the Ramapril at 2.5? Yeah, once a day, and then you've got GTN spray. Are you taking a stomach protecting drug?
No.
Okay. Is that something you would be interested in? No, that's fine. Some patients with aspirin and ticagrelor are more acidic.
Okay.
And that can lead to things or longer term. There's some patients have omeprazole that's your choice. So aspirin, we were taught bisoprolol 2.5.
What do you say my heart rate is working at? You're saying it's working at 60 and you're saying normally it works from 52.
77, so no, that's the heart function.
Yeah.
Pump side, 50 to 55 is normal, and yours was 60.
Right.
It's the paper you showed you, which is really good.
Okay.
And the bowels will look good as well.
Right, okay.
So that's good. Have you got to go back to work today?
Yeah.
It's obviously very sort of worrying, when your mum had passed away from the heart trouble, and your first had that as well. What do you do outside of work with activities? Do you do a bit of exercise?
Just walking every now and then.
Yeah. How far do you go when you walk about?
About a mile, 2 miles.
Yeah. Okay, so good regular exercise. This one's 30.89. Are you happy if I listen to your heart?
Yeah, sure.
Yeah. Good. They go through you. That's something. That's great. That's it. Just relax back into the chair for me. Good. Notice this at the back as well.
Yeah, sure.
Really deep breath. And out. And again. And again. Last one. Good. Your heart and lungs are all good.
Okay.
I'm just going to check that just one more time because I think that might just come down as well because I just want to make sure you've got good control with your medication.
Okay, sure.
There's a little bit of room to get the ramapril up if you wanted to do that.
No.
That does help to support the heart function, but that's fine, that's your choice.
Yeah. Okay.
Yeah. Ideally, you want your blood pressure, if you do your blood pressure at home around sort of 130 on 80 or under.
Okay, that's normally.
So
Yeah,
just
that's
keep it, and
normal.
it probably is that at home. It's
Yeah,
probably
yeah,
a
it
little
is,
bit
yeah.
high because you come here. And these ankles are all fine, they're
Yeah,
not swollen
that's
at all.
fine.
Can I just have a look at this up? No, good, you've got nice skin. That's good. So when you had your ultrasound here in hospital, your heart function 45 to 50, and it's come up nicely on the scan that you
Oh,
had
okay.
done, hasn't it? So which is really good. That shows some recovery of the heart.
Okay.
Haven't had the balloon angioplasty done.
Okay.
So very happy with that.
So that's actually due to the drugs.
So it's partly due to the drugs and a little bit of time as well, but probably
Okay.
to do with the drugs. And something like the ramapril helps support that even further if you did change your mind and want to put that up in the future.
Well, here's the thing. I haven't taken any of the drugs.
You haven't taken any of the
Any of
drugs?
the drugs at all, no. Some at times aspirin when I feel like it, but no, none of them. Because ivastatin and bisoprolol, they kill my dad. Ramapril also kill my dad. Glyciclin, I didn't need time to take it, and tricagrol is just a blood thinner. So basically what that does is when you nick yourself slightly, it cuts it. So yeah, I haven't taken any of the drugs. So I'm actually quite happy with that. I wanted to drop the bombshell news, so to speak, on the last minute because otherwise the results of the test would be, or your conclusions would be subsequently biased and saying, oh yeah, these drugs work. But no, I'm not taking them. No.
Okay. So can I just say that with the aspirin and the ticagrelor are especially important because when you had the blockage in the left artery,
yeah, but again, you're
you had
ignoring.
blood clots in there.
Hold on, but again, you're ignoring the fact why I had that heart attack. As I said, you know why I had the heart attack. You know, as I said, every single doctor I've spoken to, every nurse I've spoken to, ignores the fact as to why I had the heart attack. The reason I had a heart attack was having massive bars of chocolate every morning, huge amounts of fizz drinks, massive amounts of sugar. So, like I said, the fact that it's improved, it's proved that it was because of that.
But there would have been plaques on the edges.
Yeah, I know, because of
time.
I know, yes, because of that. It was over a long period of time, yes.
Yeah.
And now I've stopped doing that, then hopefully it's going to get better, yeah. Every now and then I'll take aspirin, but I'm not going to take these drugs. It's as simple as that.
Okay, yeah. I would strongly advise you to take the ticagrelor as well.
Yeah, and I would strongly advise against it. But however, that's my. Okay.
But yeah, okay, that's fine. Is there any other questions you wanted to ask?
No, that's it. So heart function, you say is good.
It's improved, yeah, and the bowels are looking good as well, so that's
okay,
good.
super, that's fine.
Yeah.
So at the moment, just to let you know, I'm taking the what's it called, fish oils, and also there's another.
Omega-3.
Yeah, and there's another drug called Quai, which is a over-the-counter thing.
Okay.
It's a natural remedy as well.
Yeah.
But I'm not going to be taking a lot of these. I'll keep aspirin on the side, I'll keep some tricathlon on the side if I need to, but
Yeah.
I'm not going to take everstatin because I don't think I need it in the long term. And
Okay.
the problems, it causes more problems than it causes solutions. Hence why asking me whether my legs are swollen and so on and so forth. Because the problem with the NHS is they don't want to. A lot of these companies have got deals with the NHS, and I know you don't personally benefit financially from them, but the NHS have got deals with them. So no doctor wants to say anything anti-everstatin at all. And the best answer I've got from my GP was, I'm not going to comment on that. You know, that's not an engineer's answer that you go, well, I'm not going to comment on that. You know, we always go.
But what we do find is patients who don't take the medication,
yeah, that's
they come back in with further heart attacks.
That's going to happen anyway.
Need
Yeah, but again, that's
doing.
scaremongering. I think personally, that's scaremongering.
That's what I've seen, so that's my experience.
Well, I don't believe it personally. With all due respect, I don't believe it. But no, I'm not gonna take those drugs. That's it.
Right.
I'll keep aspirin on the side, maybe some tricalcium on the side.
Yeah.
But the rest of them are life-threatening, and they'll cause more problems than actual solutions. I mean, they cause impotence, and the doctor completely ignored that. Oh, it doesn't matter. What do you mean it doesn't matter? You know, what's the point of living without procreation? It's pointless, basically. So that was my stance on it. But yeah, that's fine. So overall, yeah, I'm quite happy.
All right.
So there's going to be another appointment in a couple of weeks' time? Or?
No, so we don't do regular follow-ups after patients have had heart attack. It is really it's important for that symptom reporting. So if you get further types in the chest, you need to be letting people know.
That's fine.
Like you've done, come into A&E and get checked.
Yeah, that's fine. What has the ECG shown, by the way, just out of curiosity?
So the ECG today looked good. It shows a nice normal sinus rhythm, which is good. And the heart rate was good. It's sort of 70. It's on the higher side, but it's okay. It's reasonable. Let's just bring it up again for you.
And I saw Dr. Blow when I came here, and to be honest with you, his communication, I know he's I'm guessing he's your boss.
He's one of my bosses.
Yeah, I don't think his communication is very good. And he was okay. There was another bearded guy. Can't remember his name though. You might be able to.
Cardiologist or registrar?
Cardiologist.
So I've got Dr. Bloor, Dr. Reed, Dr. McNabb are the guys who work in the theatres.
He was a bearded guy, like a short beard.
Yeah, probably Dr. McNabb, Australians.
Not Australian, no, he was English.
Okay.
Yeah, but he was like, you got to cut all the diet completely.
Yeah.
All I did is cut sugar out of my diet. That's all I did.
Yeah.
And that's what I'm sticking to.
Yeah.
You know?
All we want is the best for you. We want you to do well after.
Okay, that's fine. Yeah.
So that's my job here, is to help.
But there's also an interest that the NHS have to push these Ranapil drugs and everstatin drugs and what have you without taking an individual approach to the individual himself. You know.
Yeah.
You can't just stereotype that. Okay, he's got a heart attack. Let's stick him with all these guys, which is what's happening, unfortunately, and that's why I had to get a separate opinion. Incidentally, when I asked for an ECG and not an ECG, an echo scan, an ETT scan, you've got the equipment here for the ETT scan, but they said we'll do it as and when we need one. You know, when is as and when we need one? What is that? I mean, I'm asking you. What
so
is
it would be when clinically indicated. So if you
is that not is the fact that it's 2 months after a heart attack not clinically indicative? Is the fact that the ECG went up to not the ECG, the heart rate in my last exercise 2 weeks ago that I did went up to 160? Is that not indicative? Because I think it is. You know, I think it's just. Personally, I thought it was laziness myself, but they don't want to do it, so I have to pay my own money to get this done. And look, the results are very good. So, but no, that's fine. I appreciate your help. Okay. Thanks again.
All right.
So yeah, is that it today?
Yeah.
Super.
Yeah.
Thank you very much. I don't need to. Thanks again. I appreciate it.